so much, and good morning to everybody, or good evening. I'm Delyth James, and I'm the programme lead at the Digital Health Ecosystem in Wales. I've been in post since May, but actually we celebrate the ecosystem's 4th birthday in a few months. The role we have in Wales is to bring together industry, clinicians, policymakers, academics, innovators and funders to create an environment of digital innovation in Welsh health and social care. And we're really passionate about making it easier and faster to adopt digital healthcare technology in Wales. We're actually a collaboration between the Life Sciences Hub Wales, which is the organisation I work for, and a sister organisation called the Digital Health and Care Wales, and we're funded by our Welsh Government. We bring together stakeholders across the digital health community, and we tackle the barriers and challenges to adoption and rollout. And we really enjoy connecting those projects with perfect at describing all the aspects of our ecosystem and what we do. So we support data and infrastructure, and we do this through our sister organisation at Digital Health and Care Wales, and we do that by opening up the NHS Wales systems and data to developers through a platform of APIs, and that reduces development time and ensures our products are better suited to NHS Wales needs. Because sometimes they can be quite different to NHS England, and it's really important for us to make sure that innovators know that we do have different systems. Events, these are one of my favourite things to do. We convene the digital health community through events. We showcase best practice, pilot new approaches and systems, and we hold regular events, at least a couple every month. Obviously, these are all digital at the moment, but hopefully we're making that move back to in person in the new year. And please do get in touch if you'd like to receive our newsletter, and that gives detail of all our regular events that we hold. For example, just this week, we held one with the Information Commissioner's Office to talk about their new AI risk toolkit, and that was really interesting because I think that's quite a common problem for people just in terms of GDPR and data protection rules. Funding opportunities, we like to keep up to date on all the funding opportunities, and we can provide feedback for organisations that are submitting applications to various funding streams. We can provide advice on funding all the way through from research right the way through to that development piece. Our website, we've got our own website, and we include other digital health organisations subsites within that. We keep it up to date with all our ongoing content, news articles, case studies, information about our projects and our events. And we're really keen that that website is the first port of call for everyone interested in digital health here in Wales. We also have our own active social media, and our ecosystem has its own Twitter account. A little bit of a plug there for people, and feel free to follow us and keep up to date with absolutely everything that's happening in Wales. Project management, we've got project leads within our team, and we provide bits of project management support. So, for example, coordinating between the different health boards, industry and academia, making sure that correct project documentation is in place, following up on evaluation. We're just that little bit extra bit of support. You know, if there's a really short pilot period and the health boards are struggling with resource, we can help in terms of just providing that little bit of project management support. Signposting and referrals, I'm sure lots of you do this, but this just integrates with everything that we do. Our aim is to bring everyone together to support that digital innovation in Wales. And I think there are very, very few meetings where I'm talking to someone where I can't connect them with someone else. And I think the joy of the geography in Wales is such that actually we just tend to get together quite often with lots of the same people. We're moving in the same circles, so that's really helpful. And then just around UK and international engagement, this has changed considerably because of COVID and the loss of sort of in-person events. But I do think it's actually opened up a huge amount of opportunities as well for that remote attendance. You know, being able to speak at international events or suggest speakers, and all we have to really do is take that hour or so out of our calendars rather than just, you know, the whole travel and taking days out to go to something. So I think that's great. And then the final part of this is just around that industry engagement. And I'll be completely honest, I'm not sure what element of the job I really like best, because I do enjoy all of it. But I think the industry engagement really would be up there as one of my favourite parts. I absolutely love hearing from people about the projects they're working on, the exciting and innovative things that are really going to be quite life changing for people. And I think being able to help them with the connections and the funding opportunities, or even just finding sites for them to pilot in Wales, and then hopefully making it easier and faster to adopt those digital healthcare technologies. So yeah, that was a really speedy whistle stop tour of the ecosystem